So good morning, everyone, and thank you for joining us for today's webinar on the Investigator-Led Projects 2024 scheme. My name is Aoife Cahill. I'm Programme Manager here at the HRB, and I look after investigator-led grants and any of our PPI initiatives. And I'm joined this morning by my colleague Sonia Pereira, and she's the Project Officer who looks after the investigator-led projects. So we'll start with a little bit of housekeeping. So what we're going to do today, we're going to start with a presentation, and then we'll have time for questions and answers. We would ask that the questions today are at a scheme level. If you have specific eligibility questions, or if you have specific questions around the scope of your project, if you could contact us after, and we can talk to people individually. Any outstanding questions we don't get to today, we will follow up and answer them and share them with all those who have registered. We are recording, and the slides and the recordings will be available afterwards. So I'm going to speak about the scheme, highlight the major changes since the last round, and then I'll hand over to Sonia, and Sonia's going to talk through the application itself, the process, the submission process, the review process, and the timeline. So our investigator-led projects, it sits under HRB Strategic Objective 1, and that is to invest in research that delivers value for health, the health system, society, and the economy. What we're aiming to do with this scheme is we want to support highly innovative and internationally competitive investigator-led projects that can respond to emerging challenges for health and social care. So that international competitive bit is key there. We have 4 objectives. We want to fund research that addresses important questions for health and social care. We want to support high quality, internationally relevant research. We want to add to the knowledge base at an international level. And we want to support research that will lead to improved visibility and standing for Ireland and Irish researchers. So this scheme will fund projects in 3 remits. There's the patient-oriented research, population health research, or health services research, and you will be asked to select which remit you are applying to. We define patient-oriented research as research that's conducted with human subjects or raw material of human origin, such as tissues, specimens, and cognitive phenomena. This research generally involves patients, samples, or data from patients, or other people who are not patients, for example, healthy volunteers. Now, having said this, under the patient-oriented research remit, we will consider research projects that involve preclinical studies. And this is on the understanding that these preclinical studies, they represent an important stage of research that occurs before testing in humans to find out if a drug, treatment, or procedure is likely to be useful. This is typically animal studies. However, alternative preclinical study models can be proposed. Where they are proposed, we do ask that appropriate evidence is provided to justify the choice of species, how it resembles the human condition. We ask that you describe how the preclinical study correlates and aligns with planned future stages of research study in humans. So it is expected that you are on that trajectory to go into humans. If you're unsure of scope, please do contact the HRB and we can discuss individual projects with applicants. And then we have our population health research remit, and we define this as research with the goal of improving health for the population or a defined subpopulation through a better understanding of the ways in which social, cultural, environmental, occupational, and economic factors determine health status, or through the identification of effective interventions for improving health status and reducing health inequalities. And then the final remit is our health services research. So this is research with the goal of improving the efficiency and effectiveness of health professionals and the healthcare system through changes to practice and policy. We have a list of what's not in scope. We won't fund basic biomedical research. We won't fund applications that are solely lit reviews, audits, surveys, needs assessment, or technology development, although they can be part of a larger research project. In this scheme, we don't fund projects where the results are not generalizable or actionable beyond the local and national setting. We have the applied project awards for that, or I should say the applied partnership awards for that. We do not fund definitive interventions or standalone feasibility studies through this scheme. Having said that, You can apply for funding to develop interventions. We will fund proof of concept work. We will fund trials methodology research. And I would encourage you, if you are doing this type of work, to get in touch and we can discuss individual projects. We do not fund applications that are only or just have the development of an infrastructure for biobanking or health services development, unless they are part of a wider research project. And finally, we don't fund individuals who hold funding from the tobacco industry, and we won't fund projects that are creating human embryos solely for research or stem cell procurement. In terms of scope, this will be checked at application stage. You could be deemed ineligible at this initial eligibility review or at the review panel meeting. As I said, if you have any doubts or questions about whether your project's in scope, please do get in touch, and we have a dedicated email address for queries. So the funding available, the duration and the start date. The awards have funding for up to 330,000 direct costs. This is excluding overheads. When overheads are added, this is up to 430,000. Durations are between 24 and 48 months. We are planning to commit up to 12 million to this scheme. And depending on quality, we will be funding at least 27 applications. So the applicant team and eligibility criteria. We are asking that applications should be made up on behalf of a team of researchers, knowledge users, and PPI contributors. The lead applicant must hold a post in a recognised HRB host institution as an independent investigator. For clinicians, an adjunct physician is acceptable, or the lead applicant must be an individual who will be recognised by the host institution upon receipt of an award as an independent investigator, who will have a dedicated office space and research space for the duration of the award. When we talk about independent investigator, what we mean is that you can demonstrate a record of research output by having at least 3 publications of original peer-reviewed work. Where appropriate, you're also asked to provide evidence of other outputs that have resulted in significant impact in your field. We also ask that you have secured at least 1 peer-reviewed research grant, and this can be either as a lead applicant or co-applicant. And then finally, you should show evidence that they possess the capability and authority to manage and supervise the research team. Co-applicants, there can be up to a maximum of 6 per application. These can be researcher, knowledge user, or PPI contributor, and I'll define what we mean by them now. A knowledge user or PPI contributor should be included depending on what their role is. So if they have a significant role, then they should be included as a co-applicant. And we define co-applicants as having a well-defined, critical and substantial role in the conduct and steering of the proposed research. What we mean by knowledge user, this is an individual who is in a position of authority to influence or make decisions about health policy or the delivery of services, and they can act to ensure that the findings of the research will be translated to influence decision-making and change within their organisation. So typically we're talking about maybe healthcare managers, policymakers, clinicians, health professionals, or others who are in a position to make significant changes. Collaborators, there's a maximum of 10 collaborators, and they have an integral and discrete role in the proposed research. You will be asked to provide a collaborator agreement form for each collaborator included. And then finally, funded personnel. And it's worth just thinking about who is going to carry out the work. And what we do ask is that the level, expertise and experience of the proposed research personnel really matches the ambition and scale of the project that you're proposing. And now I'm going to go through the changes since the last round. So the first one is to the budget. We've increased the maximum value to up to 430,000. Previously, this was 370. And this equates to a maximum direct cost of 330,000. Applicants are no longer being asked to include overheads in their budgets. So these will be added by the HRB during budget or contract negotiation. This scheme is not framed as a training initiative for PhD candidates, and where candidates for higher degrees are proposed to work on projects The lead applicants must show evidence of careful consideration, ensuring a good training experience for PhD candidates. And we do ask for a letter of support now from the host institution where a PhD candidate is being proposed. Other less significant changes, or perhaps significant to some people, is the call is now open to host institutions in Northern Ireland. The budget has now a dedicated heading for PPI costs, and that's public patient involvement costs. The HRB will now support a maximum contribution to postgraduate fees up to 5,500 annually, and we do not support fees for MD degrees. We have included the list of objectives are up front in the call documents, and our assessment criteria, they have just had some minor refinements to reflect these objectives. So I'm going to pass on to my colleague Sonia now, and she is going to talk through the application process, the budget and review process and timelines.
Thanks, Aoife. Good morning, everyone. Now, regarding the application on itself, for you to submit an application for the ILP, you'll need to do so using our online grant and management system that we call for short GEMS. So the lead applicant needs to create an application in this platform, and for that they need to register if you are a new applicant to the HRB. Otherwise, if you have applied for us before to other grants, you can easily log in with your credentials and start your application. Once you include your co-applicants in the co-applicants section and include their contact details, the application can be jointly completed by yourself and your co-applicants. The first thing that I would recommend you to do is to add or edit your CV details by going into the sections Manage My Details and My Research Outputs. So you can clearly update your CV as well as your publications. Once you are happy with that, you can start your new grant application by clicking on here to start it. You will need to select the correct remit here and click Apply. And once you do so, a pop-up message will appear where you have to tick the boxes to accept that you basically know how the process is, what are the assessment guidelines, and that you know the process that we will be following. To start an application, once you start, you will see that the structure of the form will follow exactly the same structure that appears on Appendix 1 of the Call Guidance Notes. So one thing that I would recommend you to do is to have that document open next to your application, so you can have the guidance next to you, so you can have all the information needed to complete each section of the application form. One thing that I would recommend you to do is to pay attention to the question mark notes that appear throughout the application next to each question when relevant, because they will display information or more details regarding what you need to fill in each section, and sometimes it will also provide links to other sources that might be useful to you. Another thing that I would highlight is the exclamation mark symbol that might appear next to the section that you are filling. And basically what it means is that that section still needs work to be done, so it can be considered completed. If there are sections with that symbol on at the end, that means that you still need to work on that page for it to be able to validate your form and for you to be able to submit it. Another thing that I would recommend you doing early on is also to identify your host institution or the host institution that you are applying with. For that, on that section, you need only to start writing the first 3 letters of your host institution. And if it is on the HRB approved list, it will appear for you to select. Once you do so, the details of that host institution will populate the next section called Signatory Notification. And this is important because you need to notify them early on that you will be applying for this school with them, so that they have time and they are aware that they have time to review and approve your application prior to submission to the HRB, since they will need to be your host institution that will submit the application for you. So I recommend you to be in contact with them. Also to know if they have any other internal deadlines for submission different from us, because again, they need to have time to review it and submit it on your place. In terms of what can be requested for the budget, in terms of personal costs, you can include salary, employer's PRSI, employer's pension contribution. In terms of salary, I would highlight that it should be the gross annual salary as per the IUA scale. It should include annual pay increments as well as a 3% contingency annually, and that is cumulative. For health and social care practitioners that are stepping out of clinical practice to pursue a 4-year PhD degree, they can request salary, but this needs to be up until a max of level 3.1 of the IUA scale, and this is taxable and cannot be changed into stipend. Otherwise, PhD students can be, for PhD students, you can request stipend, and this needs to be in line with the current government guidelines as a flat rate. And at the moment, it is 19,000 per annum. You can also include fees, and the HRB will be contribute to a max of 5,500 annually. In terms of non-personal costs, you can include running costs, and these are costs required to carry out the research. This can be, for example, consumables, surveys, participant travel costs, etc. It can also include maintenance costs for animals in case you include a preclinical animal model on your proposal. And it can also include access to special facilities or services, but this needs to be detailed as well in the infrastructure agreement form that we'll be uploading in case you require those. I would just flag that training courses and workshops, inflationary increases, costs of electronic journals are ineligible, as well as any other costs that should be under overhead costs instead. You can also include PPI costs, and there's now a heading dedicated to it. It can relate to any costs incurred related to PPI. This can be compensation of your contributors for their time on the project, their travel, training, conferences, etc. The list is not exhaustive. You can also include equipment. We don't expect it to be over 10,000 euros. Per item if justified. I would flag again that dedicated that personal standalone computers are not an eligible cost. However, if you require dedicated laptops and it is justified by the nature of the research, you can apply for those, and there's a maximum of 1,200 euros. However, higher specs computers can also be requested dependent on the justification provided. In terms of dissemination, you can include costs for dissemination of your results as detailed on the knowledge translation plan that you provide on your application. And publications, for publications, the HRB will contribute to 1,750 per article, or you can publish on the HRB Open Research Platform for free. For conferences, we have a maximum of 500 for national and 1,500 for international conferences per person on the team and year. In terms of fair data management costs, it's also a category, and it is related to data and data management activities in line with best practice and fair principles, again, during the lifetime of the project. As Eva previously mentioned, the overheads contribution, we do not request you to include those costings at this moment at application stage this time, but we require you to identify what type of research you'll be doing so we can add it later on if your project is successful during the contracting stage. But just to mention that overheads will cover costs like recruitment costs, bench fees, office space, software, etc. There's more detail of this in our HRB policy on overhead usage, and it is available on our website. And obviously, this could not be included under any other headings on the budget. The submission deadline will be the 11th of October at 1 p.m. And this is a hard deadline. Once it reaches that time, the system will automatically close and no applications can be submitted after that. But the basic process will be that once you are happy with your application, you can go to the last section and see if everything is filled, if there is any message that any section needs to be updated or there's any information missing. But if everything is all right, we'll be able to successfully validate your application and submit. Once you do so, the application will be redirected to your host institution for review and approval. If your host institution rejects your application, you will be notified together with the feedback that they provide. So you can go again into the form, edit whatever needs to be edited, validate again, and submit. If your host institution are happy to submit your application, they will approve. Once approved, it will be submitted to us, and we will provide you with a reference number to your application, and it will move on to the following steps. In terms of the review process, it is divided in 2 stages. So the first one includes the peer review by international academic experts in the content area of your project, and they will score your application based on the assessment criteria of the code. In parallel, public reviewers will evaluate your application in regards to the quality of your PPI, and they will provide a rating and their comments. Based on the scoring provided by the peer reviews, we will shortlist a number of applications to proceed to the next phase. So before we enter the panel review, we provide a short period of time where the applicant can respond to the comments provided both by the peer reviewers and public reviewers. And these, together with the application, the comments of the reviewers, and the scorings will go to the panel, and the panel will consider all these under the assessment criteria of the code, that in this case is the scientific quality and innovation, impact, and research team and environment. So successful applications are expected to rank highly on all criteria of the assessment. Going a little bit into more detail, the scientific quality and innovation weighs 40%, and it refers to the importance of the research question, if the evidence supports the need for the proposed project. It regards as well the design and methodology, if they are appropriate, if the project plan and risk mitigation for the project delivery is also appropriate. The second criteria is impact, and it weighs 30%. And this refers to potential impact on patients, on the public and/or healthcare system, as well as the generalizability beyond the research setting, as well as the knowledge dissemination and translation plan. Lastly, also weighing 30% is the research team and environment. And in this, the reviewers will consider the applicant team expertise and experience that is relevant for this project, or the project that you submit, the supports and infrastructures and environment, as well as the project staffing and funding. For the public reviewers, the focus will be mainly on PPI aspects of the project. So the public reviewers will assess the plain English summary, the lay summary, the relevance of the proposed research question, the PPI in the development of and throughout the project, if the applicant is making it straightforward for research participants, and as well they will assess the dissemination of the proposed work in relation to PPI. And when it reaches the panel, we will advise them to take the PPI approaches in consideration if they are relevant under the assessment criteria. In terms of timeline, the call is aimed to open tomorrow at 1 p.m. And as I said before, it is a hard deadline on the 11th of October at 1 p.m. as well. After which we will start the peer and public review phase that should go through November until March next year. Mid-April will take place the applicant response, followed by the panel review meetings in May, June. We expect to present to the board the panel recommendations in June, after which, if we get approval, we will start the contracting stage during July, August next year. And the earliest start date for your project will be the 1st of September 2024. Just the final slide to say that there are supporting material that we actually recommend you to read, namely the ILP guidance notes, also the FAQs, and I would also recommend you to look at the HRB website to look into what we typically fund under ILP. Otherwise, we also encourage you to get in touch with us. Please email us for ilp@hrb.ie if you have any queries or anything that you are uncertain of before your application. So thank you. I will pass now to Aoife again so we can start the questions and answers part of this webinar.
Thank you, Sonia. So we have a couple of questions in. I'll go, excuse me, I can go through these pretty quickly, I think, because I've had a glance at them. But any other questions, please do ask as well, and we'll see what we can get through. So the first question is, will the webinar be available after today? And yes, it will. We're recording and we will share slides after this and the recording. Then we have a question around eligibility. And does the lead applicant need to have been successful on a previous HRB grant, or can this be another grant, for example, peer review grant from UL? So previous funding does not need to be from a HRB grant. We just say that it has to be peer reviewed. So you would have to provide evidence that any grant received is peer reviewed. And it does have to be for research. It can't be, say, for training or travel. And we have a question around the definitive interventions. Is it possible for a translational side study or a SWOT from an ongoing RCT to be funded? So we do fund trials methodology research. So there you could, I mean, that could be the SWOT study you're referring to there. And yes, potentially side projects, translational side projects could be included. I think to be on the safe side, if you could contact us with project details and we can confirm eligibility, that would be great. Then we have a question around if an applicant is submitting to both our secondary data call and this call with tailored but related applications, and do they need to notify HRB to ensure eligibility or alignment? So we do ask in the application whether you have submitted something similar. So there is that opportunity there for the applicant to include that. You do not need to check about eligibility. The one thing I would say is that obviously we won't double fund, so they would have to be distinct pieces of research in both applications. And then we have a question around eligibility and whether it has changed since the last round. So it hasn't actually changed. It's the lead applicant eligibility is the same, and how we define independent research is the same. So I think the confusion there is probably that the definition of independent researcher is probably not on our website, so it's caused a little bit of confusion. And we have a question around the increased PhD stipend, and it is proposed that it's going to increase to 25,000. And once this does come in, yes, HRB will be making those changes to stipend, and in exactly how we do that will have to be approved by our board. But yes, we will be ensuring that PhD students receive that 25,000 once it comes in nationally. And a question around dissemination. For conferences, costs are limited to 1 per person per year. We're talking about the applicant team, so that's lead applicant, co-applicant, collaborator, but also any funded personnel. So anyone working on the project as well can be included there. And then another question about collaborators and whether they can be sent funds. So any costs for collaborators, they can be included as a running cost. If it's a salary, only people who are employed directly on the grant, a salary can be included but you could, collaborators' time could be included as a running cost, but it couldn't, I mean, you wouldn't be able to put a salary in as a running cost, but it could be, you know, consultancy time or whatever way that would be charged. Can a soon-to-be PhD student or postdoc be included as a co-applicant? Yeah, we don't have eligibility criteria. They would obviously have to, have the skills to do whatever it is that's being proposed in the application. So that would have to be considered there. Is there an expression of interest stage? No, it's just a one-step full application. Would randomized efficacy trials be eligible? No, we're not including trials. But as I said, the development of the trials are allowed to be requested. So if you do have project-specific questions, please do contact us directly afterwards. So the scheme is open to both the Republic and Northern Ireland. So sorry that we were highlighting the change there when we said Northern Ireland is now included as well. So that is in addition to the Republic. And are we interested in funding global health projects? Can funded staff be based outside Ireland? Yes, they can be based outside Ireland. So yes, is the answer there. But obviously you do need your host institution in Ireland. We just have a question about open access. And our open access fees allowable for major journals. So we have our limits there, our recommendations there on what we will include for dissemination. Apologies now, I'm just making sure I answered that correctly. You know what, I think I'll get back and follow up on that. I think it might be best, so I'll follow up with that with everybody afterwards on that one. And what would evidence of peer review, or would you accept a research funder process, say SFI or EU? So I think this is in referring to the eligibility, and you will be asked to include a peer-reviewed paper that has been published. So if an applicant was not successful in previous ILP calls, should the changes be addressed, the reviewer comments specifically highlighted? If you haven't been successful, I would suggest that you weave in that it's a resubmission. We do ask, there is a question where we do ask that, is it a resubmission? So I would say highlight it there, and where you agree with the peer reviewers, I would put that in the project description, that the changes that you have made and that's a resubmission and you've taken on board. So I think it's always worth highlighting where you have changed an application in relation to feedback. And then we have a question about in the guidance notes. We do ask that anything you're proposing is supported by evidence instances. And yes, we're not saying that you have to do this yourself. We'd ask that you see what's been done out there, how it is publicly available, and that can be used as evidence for the need for the study. I'm not sure if I answered this, and please jump in, Sonia, because I'm racing through these. If there's anything there that I'm not answering as well as I could. I think I've answered that question. So as I said, if some of them we can go back through the questions afterwards, and if you know, if there's something else that I can add, we will follow up afterwards as well. So I've received funding as a co-applicant for secondary data analysis project in Australia. Is this eligible? Is it eligible as, I presume that is, will you be eligible? As long as it has been peer reviewed. I would say again, if you have any doubts, just give us a shout and send us an email, and we can absolutely confirm that. Now, Sonia, you might want to jump in on the levels here for the funding of the clinical staff member who's could be doing a PhD.
I think it's level 3.1.
Of the IUA scale. So you can request up to level 3.1 of the IUA scale for a clinician who will be stepping out to do a PhD.
Mm-hmm.
In terms of previously funding, we do have a list of previously funded projects. They are on our website, and they'll be on our website and they have all the abstracts there, and we can share the link to them afterwards as well. So
actually, on the website for the ILP, we left a link directly to what was funded previously on ILP, so it is easy to access.
Okay. And then with scaling up and knowledge translation activities, I mean, it's hard to answer that without knowing what that is, but it does have to be a research project. So assuming it's a research project, yes, but if it's just knowledge translation, then I would say no, but I would say maybe contact us directly and we can have a look at that. Does the call run on an annual? It's every 2 years we run this call. So the projects will start from September 24. Oh, there's a question just about employer pension contribution and the typical Northern Ireland rate. I think I prefer to have a look into this and get back to you on that, because we haven't come across that question yet. Obviously, it's the first time we've opened up to Northern Ireland. So there's just another question about the clarifying the definition of independent research grant. Would a peer-reviewed grant for a PhD research be included? If it's an individual grant that was received individually, so that student was peer-reviewed to receive the funding, then yes, that would be eligible. And again, I would say, please do contact us directly, and we can confirm that as well for you. Can someone working in a hospital in research role but not a clinical role have an adjunct position? I would say, depending on what hospital you were in, you could be linked to a university, but it's really up to a university will decide whether someone warrants, I guess, receiving an adjunct position. So that would be a discussion that would have to take place between yourself and the university. And then just some clarity on a professional undertaking a PhD and receiving a salary. This is for health and care professionals. So nurses or clinicians who are working as a health and care professional who are stepping out to do a PhD, they can request a salary in this instance. And then are public review scores included in the evaluation for shortlisting? No, so applications are shortlisted based on the scores received from the peer reviewers. Public reviewers give a rating, and we do ask our panel to consider that rating. So they will see the written feedback and the rating provided by public reviewers, but they're not used for shortlisting. And then just a question on remits and whether it matters whether an application fits neatly into one category. And but no is the answer. The Population Health and Health Services Research Panel is actually one panel. So if you are putting into either one of those remits, you will actually be going to the same panel. When if we come across an application that we think is a better fit, we do move it. But that's more important, obviously, if you're moving from patient oriented to rather than moving between these two categories here. For research, is there a word limit? Yeah, we have word limits on every section and every question. And then just a question on start dates. It's usually within a year of getting the contract. So should you be successful, we contact people and we confirm start dates. The majority will start in autumn 2024, but you can push it out for within a 12-month. And then obviously if there's other reasons, like someone is going on maternity leave, there's obviously flexibility there to push things out a little bit further if necessary. There is a question around expression of interest. We don't have an expression of interest phase for this. And can funds go towards software or infrastructure development? But it does have to be a research project. We won't fund just say a health services development. If software is needed for part of a research project, then it can be included. I would say, again, this is probably one that will be best to come into us and outline exactly what you're thinking, and we can give you a definitive answer there. And then will a resubmission be sent to the same reviewers? Not necessarily. The peer review, it starts, like the clock starts again with peer review. Potentially there'll be the same panel members though, you know, than they had the previous time. And we've got about two minutes left, so I'll just maybe answer 2 more questions. We'll see how we're doing for time. And yeah, that is correct about the open access and the limits that, you know, they're usually around 3.5 to 4,000. We do obviously have our HRB open, where anyone who we fund can publish for free. I know that's, you know, that doesn't work for everybody and where they are at their career stage, but that option is there. Now, I think I'll finish off there just so we're within time. And we will run through the questions again, and if there's anything that Sonia may have picked up, if I didn't answer anything, fully answer anything, we can get back to you, or questions that I did not get to. So we will be looking through all of these questions again. So I'd just like to thank everybody for joining us this morning, and reiterate anything to do with scope or eligibility, please do contact us directly. We would much be happier to give you advice now and then come in with something that's perhaps not eligible. So just to say thank you, and thanks Sonia as well.
Thank you, everyone.